This next section focuses on providing trauma-informed care within a long-term care facility setting. Long-term care placements are very stressful events, not only for the client, but for the family. You can have a lot of emotional issues, social issues, losses, such as that of autonomy, independence, and of someone's home, as well as family conflicts, especially if the client and family were not all in agreement with the plan of care. Long-term care facilities may give the client trauma cues that they had been avoiding for most of their lives. Long-term care facilities can feel sort of dehumanizing. The structure and routines may be perceived by the client as invasive. There might be loud noises and bright lights that are frightening to the client or interfere with their sleep patterns. Your client may feel a loss of control within this setting or feel unsafe because it is a new environment for them. Physical illnesses, death anxiety, isolation, and an increased need for assistance with personal care are just a few of the trauma triggers that can cause an intense negative reaction within your clients. PTSD symptoms are actually higher in long-term care settings than they are within the general population. When you think about it, we are asking a vulnerable adult to allow a stranger, usually several strangers, because there will be different caregivers throughout the day and night, to provide multiple aspects of personal care, such as bathing, feeding, toileting, pericare, incontinence care. We are asking our clients to trust these strangers implicitly. For someone who has survived trauma, this is easier said than done and is going to be met with a lot of anxiety, panic, resistance to care, and agitation. Caregivers need to be in tune for the presentation of symptoms such as traumatic stress when caring for clients in a long-term care setting. It is more common than not for those people you are caring for to have had some sort of traumatic experience in the past. The idea is to approach all clients within a long-term care facility with universal precautions. Just like you would wash your hands before providing care to a patient, treat all clients as if they may have experienced trauma and may have a traumatic experience to the care you are providing. It is important to watch for potential symptoms of traumatic stress and use what clinical skills you have, either as a social worker, nurse, nursing assistant, to explore these feelings with them within your scope of practice and what you are allowed to do in this setting. The key is to focus on what has happened to the client and not what is wrong with the client, with the ultimate goal being to do everything possible to avoid re-traumatizing your client. I'm going to talk about one way how to provide trauma-informed care in a long-term care facility. This is the theory made by the Substance Abuse and Mental Health Services Administration. They have several key assumptions and principles for the long-term care facility, things that the caregiving staff can do, and how they should act when providing care. The first is using the 4 R's. Staff members will realize how trauma can affect the clients within their care. Staff members are trained to recognize the signs and symptoms of trauma. Staff members then respond to the client by utilizing trauma-informed approaches with their care. These trauma-informed approaches are designed to resist the re-traumatization of their client. To do this, there are 6 key principles. The first is ensuring safety. Long-term care facility and the therapeutic setting that the client is in are perceived as safe by the client. The next is trustworthiness and transparency. Decisions made about the client's care are made with a goal to build and maintain the client's trust. Also within this is respecting the client's personal boundaries. Next is collaboration and mutuality with the client. All staff members and the facility are working toward the same goals as the client for the client's care. In this, we want to avoid blaming and shaming the client, and we want to monitor how we document aspects of the client's care to make sure that we are not blaming the client for any behaviors or shaming them for anything they have done. The next principle is recognizing culture, history, and gender, and how this affects the client's care. We want to identify instances of historical trauma, recognize the healing value of the client's cultural connections, and remove gender and cultural stereotyping from our practices. Next is client empowerment, client voice, and client choice. We want to build upon the client's strengths, allow the client to make choices as they are able to, and allow the client to maintain a voice in their care and the goings-on of the facility. The last principle is peer support. As able, we want to encourage group support from other residents of the facility with this client.